So we are live. Connie, good evening.
Yep. Good evening.
So good to have you here. So good to see you here, on camera. I know we had conversations over the phone, and I, got to know you a little bit, and I, very excited about what you do, and mainly, originally reaching out to you about, education. Education as a, is obviously something that's, you know, mainstream in one sense, but also from my perspective at least, not really mainstream because um, I think education means so many different things to so many different people in the niche that we're in, and I think many other niches. I think it's just ever evolving because we're always whatever you teach is always evolving. Even and I don't want to get too conspiratorial, not conspirator.
Conspiracy theory.
Yeah, I don't want to get too much on that side of things. But even the most grandiose things that the most the axiomatic things that we live our lives by also evolve.
Yeah.
So the teaching, by default, has to evolve as well. So I
Mhm.
wanted to, first, maybe start from what you do now in terms of, education. Where you are with your education, how you approach education nowadays with all these new tools and being online and doing videos like this and sharing knowledge like this. Where are you now and how is it for you?
Well, like you said, I'm very much evolving. I feel sometimes like I'm still in kindergarten learning the basics because I grew up with no phones, pretty much a wall phone, no computers. And of course you're learning as you go, which we do. And then in medicine where I am all the time is we always have new tools, new products, things being thrown at us. Here, try this, let's see how this works. And so in aesthetics, which is my main focus, and I'm also in wellness and regenerative aesthetics, is that there is so much collaboration between now regenerative aesthetics, aesthetics as in let's look pretty, and also wellness. So we're in kind of a lot of the wellness world. And so that's been really exciting. So I'm always being educated. I think I probably study 10 to 15 hours a week. I usually have a couple classes I teach each week, and I usually take some too. So I'm always kind of learning new things. And so, like you said, how we taught just a year or two ago is very different than how we teach today and how we'll teach tomorrow. So some things I said a couple of years ago may not even be valid at this moment. And it's kind of exciting. It keeps you from being bored.
Yeah, so what other classes do you teach?
So I teach for 5 different companies. I teach some CME courses for aesthetic nurses, doctors, PAs, NPs. We do virtual classes kind of like this. We'll have 20 or 30 online, and we'll be lively demonstrating from this table right here across the camera so that you can get 2 hours of CME. And then I teach hands-on courses through the companies that are industry that make the products we work with, so we can kind of educate people on how to use them and what depths, all of that. And so that's pretty exciting. And then we have some independent classes I teach and some one on one. And I have an apprenticeship always going with some younger nurse that I can mentor and teach. So there's always education kind of in my day to day life. So it's just a part of who I am, which I love.
When did you start teaching?
2002 was when I started teaching. Well, no, actually, pardon me, 1997 is when I first started teaching, and Botox was not FDA approved. And I had gone in 1996 to learn what to do with Botox because nobody really knew in Minnesota, and brought it back to Minnesota. And I got calls like, how are you doing that? And what are you using? And we really want to understand that. And so basically, I started teaching my competitors and my colleagues, like, here's what I know today, and I don't know if I'm doing it right because we don't have any teachers, and the teacher that taught me isn't a teacher. So let's just try some things together. And we made a lot of mistakes and really evolved our practice in the Midwest before any teachers ever got here, which was exciting. And then I established a training company in 2009. But I started teaching for all these companies back in 2002 officially because that was the first FDA approval of Botox. So that's when they brought teachers together that we could actually teach on label, which was kind of exciting.
Was the main catalyst for pushing it over the line and getting it FDA approved for beauty aesthetic reasons, or was it more for the medicinal side?
Originally, Botox actually had a different name back in the 80s. I believe 89, it got its first FDA approval, and it was FDA approved as Oculinum. That was the name. and it was FDA approved for strabismus, which is cross eyes, so that the eyes would relax and wander back out into their space, and also blepharospasm. And that's where the eye muscle, the orbicularis oculi muscle, squeezes the eye to the point where patients can't keep their eyes open. It's very disrupting
Mm.
to them physiologically, physically, and emotionally because it's really challenging. So it was FDA approved for two eye basically diseases. And then once that FDA approval came through, what happened is they noticed that crow's feet were softened because they were treating this muscle for spasm. And so then they got involved with dermatologists, oculoplastics, and they decided that this was probably one area in the cosmetic world that was a negative effect on the face. And so they started trials on that area versus this area. And so it was kind of an interesting transition for aesthetics because plastic surgery has been around for decades and surgeons have been trying to correct various lines on the forehead, and they have to be very careful because it's a delicate place. Brow lifts can only do so much for this line, and when they cut this muscle, which they used to do a long time ago in surgery, some of those fibers would grow back and patients would still have the frown area and those deep grooves in there from fat loss. So FDA approval was kind of, it took a while from what, 88, 89 to 90 to 2002. That was a lot of years between the original um, approval for, we call it therapeutic result, to cosmetic. And then from there, it just started, there's a lot of FDA approvals now for Botox. It helps a lot of people with a lot of situations.
Yeah, and it's so I did not know that it started, around two eye diseases, which is very interesting. And before we went live here, you mentioned to me just the like the misconception around really what Botox does. You said the misconception is around the numbing of the nerves.
Mm. Well, some people will come and they go, I just don't want to be paralyzed. And they use the word paralyzed because it's very, very scary, thinking you're going to
Yeah.
paralyze my muscle. And it kind of got that terminology around it. Also being a toxin, like people are nervous, like it's a botulinum toxin type A. So that sounds scary. It's going to go in my body. What is it going to do to me? And when you think about Botox and really all the other neurotoxins, we call them neuromodulators on the market, are basically enter you as a human as a purified protein. They're not a live toxin. They're derived from it, but they're purified protein that goes into your body. And we have a lot of other proteins and peptides that we inject into our bodies for various reasons. But when you think about the mechanism of action of Botox, Dysport, Daxify, Jeuveau, there's a lot of them, Xeomin, is that when it goes into the muscle, it basically cleaves the SNAP25, which is a kind of a portal for activity, and it basically quiets and relaxes the muscle so the muscle cannot move so much. And you can dictate how much you want it to move by your dosing. And so you can lighten the dosing if you want the muscles to still move a little bit. If you want that muscle to be really sleepy and quiet and not moving, you can dose a little heavier, according to that patient's need. So you really can modify it and customize it to your patient's needs. So it's not a paralytic it's more of a neuromodulator, we call it in our practice.
Yeah. Are there, and I think that's, the reason also that I had my misconceptions, but also just negative connotation to it. And, mainly in the movies when you see someone with like, half a, droopy face or, like numb parts of their face or paralyzed, bits of their face.
Mhm.
So that's what kind of gets, thinking about those things. Do those things happen? Are there any like potential dangers for even small procedure? Do you call them procedures?
I would say treatments. We kind of call it
Treatments.
treatments. They kind of
Treatments.
sound less scary. A
Yeah.
procedure, we kind of think about being sterile and, the patient has to be like, and we do as a treatment, make sure the patient is clean. We really don't want to cause any trouble. The goal of these treatments is really no trouble and to benefit the patient. That's really why we want to do these treatments and help patients. When the muscle is resting on the face, then the lines on the face don't deepen. Like you may come in as a 70-year-old guy and have really deep grooves all over, right? Because that's just aging, it's sun damage, lots of things happen with our skin. And when you apply a Botox or something to those muscles, you're not going to erase wrinkles. It's not a wrinkle eraser. if we can catch it before that wrinkle gets too deep in the skin, it's kind of like, imagine you folding a piece of paper over and over and over, right? I'm causing a wrinkle because I'm just moving constantly, which is fine. But as I do that, that paper gets that crease in it. And that crease is almost to the point where you could rip that paper. It's damaged, right? From just the bending. If I set a book on that paper, so that paper cannot move, that line gets less, right? It might slowly disappear, but you still, if you look up in the light, might see the damage that occurred in that piece of paper. So the goal is we're kind of putting something medicinally into the muscle so the muscle relaxes. It doesn't bend so much anymore. So I'm kind of helping the skin regenerate because skin is a living organ. It's not a piece of paper. And the cells can regenerate if there's collagen and elastin there. And also the top of the skin sloughs over time. So your cellular level on the surface of your skin will slowly regenerate. So hopefully over time, I can maybe make those wrinkles that are deep soften by maybe 20 to 30%, even if they're there in the skin. And if I start young enough, I can maybe prevent that line from coming in because that muscle's not moving so much against the skin. And yeah, we can really do weird things. Like I can put a lot of medicine here, no medicine here, and a lot of medicine here. And I can get this brow to jack way up because I'm allowing this muscle to move a lot and taking away the antagonistic muscles that hold it down. So that Jack Nicholson look that, we see and we're afraid of, we can actually create that on the right patient. That's not our goal. We want to create more of a really nice, beautiful arch for females. And for males, most males that want to be masculine males don't really want that arch. They really need their flatter brow. So we really try to look at, like, you as a guy, maybe there's males that want to identify as females. So we're kind of shifting their muscles a little bit, trying to help them achieve their goal. For females that want to maintain a feminine brow, we'll try to achieve that with the medication. So we really try to accomplish more of a beautification versus something that will actually go the opposite way. That wouldn't be the goal. If you want to know about like really bad things that can occur with, let's say, Botox or toxins in this upper face, the really bad things that can occur is if I put too much product in this medial space. We call this kind of the frown area or glabella area, and I get too deep and too low on the brow area, there's a little muscle here that I can actually have the product hit, and it can actually lower the lid. And I call it the garage door opener. Doesn't work anymore. So that lid will lower. And it's a little bit of time before that will come back. It can be a month to 2 months before the lid will open all the way. We call it lid ptosis or lid drop. And if I really hit the brow muscle, that frontalis muscle, with a lot of medicine, I can lower that brow and just totally relax it so it can't elevate anymore. And in doing so, if you have a lot of lower lid tissue here naturally or genetically, and that brow relaxes, it might make you feel that your actual lid tissue is heavy. We call that brow ptosis. Those are probably the two things that patients kind of fear
Yeah.
because it changes their look and they don't like it at all. And it's never the goal, but it can happen. And there's anatomical regions that it can, or reasons why it can happen. And we're always watching patients to make sure that they don't have a natural lid ptosis or a natural brow heaviness, because those are the patients that are more prone to getting that. So those are the two worst things. Other things are, whenever you put the needle through the skin, you could get a little bruise. That's pretty not uncommon. It doesn't happen a lot with the toxins, but it can happen. And then a little redness sometimes where the needle's put in, which lasts just 15, 20 minutes more than likely. And then once in a while, we'll see patients that will kind of get a little swollen mark kind of right where the needle went in if they're kind of sensitive. So we say, bruising, redness, swelling are not uncommon, but these other things are very uncommon. Brow drop, lid drop. Even I caused a patient to have double vision one time, and I knew not what I was doing because it was a long, long time ago and there weren't any teachers. But if you go too deep and too into the lateral rectus muscle of the eye or around the eye, you could actually get some of those muscles to kind of weaken. That makes the eye go back and forth, which is why strabismus was so successful. If they targeted it right, it would make the eyes go out where they're supposed to. But if you hit too deep in here, I can actually make the eye a little lazy and then it gets a little double vision. That's not the goal either. So those are things that we have learned by mistakes we've made as providers from a long, long ago. And we teach everybody how not to make that happen, hopefully. And so my passion is I've learned by my own mistakes, and hopefully I can teach you so you don't make the same mistakes, which is a wonderful way to go for the up and coming practitioners that are just getting into this. They got a lot of classes available to them, which is so great.
So, so you're saying if someone is certified and has to have, does have experience practicing, these mistakes, these occurrences are very uncommon these days.
They're much less. And the word certification is kind of an interesting word. I'm glad you brought that up because in front of my initials, you see a C, which is a certified nurse practitioner. So nurse practitioners have to go through a board exam. It's recognized by it's a federal kind of certification that
Yeah.
we have to take an exam to become a certified nurse practitioner. Um, in Botox, Jeuveau, fillers, all those things. There's really no official certification that you get through like the government or federally. There's only one certification right now on the market through the American, or it's actually the International Society of Plastic and Aesthetic Nurses that offers a federally known certification for certified aesthetic nurse specialists. And so that allows, and it basically certifies a nurse to be in aesthetics and to let patients know that they've actually taken extra courses and an extra exam. But when you see companies say, I'm going to give you a certification in Botox, it's actually just a, hey, you participated in my class. I'm going to give you a certificate of participation, not an actually governmentally known certification.
So, do individuals have to be careful who they, who they go to get
It's wise.
these treatments?
It's wise. It's very wise. And I would say that patients, Groupons aren't the way to go. You don't want to be cheap about your face because Groupons are usually people that really desperately need patients, right? They're trying to fill their chair, they're trying to pay their bills. They may not be the ultimate one you want to start on your face. I would say the people that you want to start working with are people that have a good reputation. You can usually find that out by word of mouth. Probably your best friend had it done and says, I went to her, she was great, or he was great. Also looking at their credentials. Do they have a medical license behind their name? Are they medically trained? Because I will tell you in Minnesota, our laws here are very gray. So are they in Colorado. You could have a garbage man with no nursing training or doing your Botox for you. And he can say all, or she can say all day long, like, yeah, I can do this. I have a doctor that's my medical director, but are they even medically trained? And some of them aren't. So you want to really be careful and really look at credentials, years of practice, people they've treated, maybe look at your friends. And if you like their look, that's who you see. If you don't like their look, maybe they're not the one to go to.
And mistakes, your mistakes, or bad treatment, bad side effects, or someone doing a bad job on someone's face. You're saying also these, it's reversible because it kind of flushes out the system after a few months, even with something like the eyelid shutting or not working anymore.
Yeah, when you're working with the neuromodulators and something happens where you're not happy with it, it's not something that I can put an enzyme in and break it up and make it go away. But I usually tell patients it's a tincture of time because all the neuromodulators type A that are on our market in the aesthetic world are something that goes away. Oh, they're temporary. So they're not around forever. Sometimes we wish they were because we really like their results. Like, gosh, if that could last forever, it would save me a ton of money and time. But botulinum toxin type A, which is what we use primarily in aesthetics, is a product that within 3 to 5 months is going to basically leave and the effects are gone. So if you get an outcome that you're not happy with, more often than not, the result's going to go away shorter than 3 to 5 months because it starts to kind of degrade at around that 2 month, 2.5 month, and then slowly goes away. So if a patient does call me, and I've created things that I'm not proud of either, to be honest, because in years past, we, like you said, we evolve and we do a better job as we're more, in the moment and doing more and more patient treatments. So things that happen that go wrong, we dive in and we look at why did they go wrong? And maybe it was that I didn't do a good enough assessment, knowing that patient had already ptosis, and I just weakened their weak muscle a little more. And now I've got ptosis that I didn't see before, because some of these things are millimeters. And you're like, did I not notice that before? And then you'll look back at a picture that you took and you're like, well, of course, their little iris is covered a millimeter more on one side than the other. They're already weak. And now I just weakened it some more. Well, that was just great. So it's really on our part to do the best we can on the assessment side and, discussing your needs as a person, like what do you really want from this and your goals, because maybe the goals and the outcome aren't aligning with what you really wanted.
In the late 90s, when you were first exposed to this thing, could you, like, see into the future that it's going to get so popular and, so widely used and FDA approved all over the place?
No, no, I was just pursuing the education because I felt very passionate about how can I help my patients get a better outcome than what the tools we had. We had collagen and it was made from a cow. We had a lot of allergies back then, and we really couldn't treat upper face with it very safely. And this just sounded like such an awesome product. And being a girl that likes to look nice, I'm like, selfishly, I want that product. How can I get a hold of that and try it? And honestly, when we first started learning, like we were taught to mix it in the vial with a lot of saline. Well, when you dilute a medication with a lot of saline, you're going to have more spread. And so the FDA dosing right now, if you think about this, is 20 units in the frown area. That's the FDA clinical trial. We were mixing it with a lot of saline, and then we were putting 30 units right here with like 10 times the amount of saline. So if you can imagine the spread of effect and what happened to some of our patients, I really made a mess of things. So
But that's the reason why, like, we on TV and the celebrities, we would see all these funny pictures.
mhm, yeah. And you'd see I think I have it from back in the maybe late 90s or early 2000s, a picture of a woman's face, a cartoon character, and there was like 8 of her, the exact same face, and on the bottom it was labeled happy, sad, mad, and all the faces are the same, and so it was like a real joke about the Botox in particular, and now all the toxins, that if you get this done, like, you have no expression and I can't read your, you know, vibe, but it's just not true. I mean, it's kind of a fallacy, and I think now that we're here, we all know that, or most smart people that check into things know that, but there are still a lot of people that are fearful and that come into our practice, and we sit down and we just chat with them about what the product is, how it's delivered, we can really accomplish a lot of goals. Even just softening an angry look can help people in their day-to-day life. And interestingly enough, there's a lot of information about when you work with this frown area, this patient's mood actually elevates. There's actually clinical trials that were started on that. So when you think about, like, why is there an angry look here? Is it because I'm angry and I'm projecting that, or that what's out there is making me feel bad and now I'm, frowning at it? And I said, I'm the happiest person in the world. I've had Botox in my head for almost 30 years, and there's just no angry threads in there.
I've also, in Chinese medicine, I've had even on the podcast, engaged with some Chinese medicine healers, and they always told me, specifically me, to stop, like, frowning that area, because I'm just causing more angst and stress, in my system. So
Mhm.
according to those practices, so you have a little cheat code to help with that. You know, what do we like today? Are we still learning all the time about, the use of Botox, and other products as well, similar to Botox, or, in the same realm that people use for aesthetic reasons?
Oh, definitely. So it sounds kind of strange, but when Botox first came out, they only had one indication for aesthetics. And of course, as providers, we always are, challenging the norm of, like, let's try it here and let's try it here and let's try it down here and let's try it all here. And let's just keep going and see what we can accomplish, because we know that there are muscles in the face that pull us down. And we know that there are muscles in the face that pull us up. The goal is that anything that pulls us down needs to stop, and all the things pulling us up need to continue. So we challenge that with, like, how can we treat these particular muscles and see what happens? So we've done all of that. And now Allergan in particular owns Botox. They just came out with one more indication, the platysma muscle, which is this big muscle on the neck that pulls us down. Ladies in their 50s hate their necks. They get crepey, they get banded. And so the platysma area is an area where we've been doing Botox for years, but they finally got the FDA approval. And interestingly enough, when they get an FDA approval, we can finally start teaching to it on label, we call it, to our providers, because providers cannot get on label information from companies unless they have an FDA approval. So it's been a challenge because we've done these things for years. Now we finally have the FDA indication. We can finally teach it on label, even though we've been teaching off label. The other thing is, think about this. This was approved in 2002, and the actual injection points were above the brow quite a bit. And we ended up dropping a lot of brows because we were hitting the elevator muscle, the frontalis. So even recently, within the last 2 years, they went through FDA trials again, and they actually lowered the injection points and were reteaching people how to inject properly because of what it was creating. So when you think about like 20 years on the market, we are now reteaching people new injection points, different depths, almost 18 years later, 19 years later, with the same product in the same area, just a little different nuance, which makes it even better for our patients. So we're learning all the time. And we have some great anatomists that we work with to look at cadavers, and we kind of inject in their heads and pull them open. And, we so appreciate that education because information on anatomy is different with each of us. We just have very unique faces. We're one of a kind. And so when you start looking at lots of cadavers and then lots of live faces and lots of outcomes, you can start to put together like, oh, that really didn't look as good as I thought. How come? And now I can take that into my next day of learning on the next face. It's kind of like that.
So, what state did you go to when you were first exposed to all these things in the late 90s?
So I started working as a nurse in Minnesota, and then I traveled. Then my first kind of travel out was to Chicago, where I was in a plastic surgeon's office, and we were working on Botox and sclerotherapy. Sclerotherapy is where you inject veins and you see the little veins kind of just go away. And a lot of women's legs, have little veins, spider veins, we call them. And so that was kind of my first exposure to Botox. And I had been exposed to sclerotherapy, but I had never injected it myself. And then I came back to Minnesota and kind of added those things to my practice. I was working with a plastic surgeon at the time, and I still work with plastic surgeons today because they're a wealth of knowledge, and it's lovely to have that collaborative, like, hey girl, we're so saggy now, it's time for a facelift because what I have doesn't work anymore. So onward they go to their next little goal. So it's great. So that was my first travel back then for seeking education. And now I travel probably, oh gosh, maybe 10, 15, 20 times a year to seek knowledge outside of Minnesota. And then I also go outside of Minnesota to teach. So I'm on a plane a few times a month at least.
Yeah, but back then you mentioned that you learned these things outside of Minnesota, and you're one of the first people to like kind of bring these new ideas and products to Minnesota. Were people shocked? Colleagues, did people think you were like crazy for playing around with these neuromodulators?
I think people were curious, and I think I was doing something that none other nurse had done in our state, which was, negotiating with a plastic surgeon. Like, I want to be in your practice, but I want to kind of run my own practice within your practice and partner with you. That wasn't really an RN kind of role back then. It was very different. And so people were kind of like, wonder what she's doing. And then they thought I was nuts for teaching my competitors. They're like, why is she teaching her competitors? Like, she should just, and I just felt like it was really important that I would create more of a collaborative environment around me, because I felt at the time that if I would teach my competitors, which I had no trouble doing, that the more of us that did a better job, the better our community would be and the better off our patients as a whole would be. Because let's say they couldn't get in to see me because I'm busy or don't have, and they go to see you as a provider, and you have been trained and you know what you're doing, at least their outcomes should be good, right? And they're not going to go to somebody who makes them look crazy. And so I had a real passion for like, I'll teach you anything I know. If you're serious enough and want to learn it and are going to implement it in your practice, I'm happy to do that. So that was kind of my thing. But people did think I was kind of crazy. Like, why are you doing that? And there is a lot of competitiveness in aesthetic medicine, even today.
What gave you the confidence to, like, as you mentioned, negotiate with plastic surgeons?
I don't know actually what it was. I was always kind of a sassy child. I moved every year to every 6 months in my childhood, so I went to 15 different schools in 12 years, and I was shy as a young kid, but I realized really quickly at about 10, 12 years old that I had to, like, stop that because every year I had to try to make a new friend, and it's easier to make a friend if you talk to somebody than to be shy. So I kinda had to force myself to do that, and then I was always pretty sassy to my parents because I don't know, I just was. So I think that some of that was that I had to make a way for myself. I had to figure it out. I was never pampered, grew up really poor and had to go to work and make it the best I could be. When my first job was babysitting at 10 years old, and I had to take care of children and a lot of them. And I had to make decisions that maybe a 10 or 12-year-old shouldn't have had to make. But once I did, I was like, I got this. And, I think it's okay when you make your way as a young person and have, adversity builds character is what I always thought in my head. And that's
And what and why new school every 6 months?
so my dad, who is awesome. He's not here anymore, but his mission, he was a very passionate man, was to start Christian schools and churches. He was a pastor. And my mom was a nurse and a teacher, and she was an elementary education teacher. And so the two of them would start up a small little Christian school, help things get going, move on to the next calling. And so it was kind of, a lot of different schools. Some school years, it was two schools, some it was one, and it took us around, across the country. So we got to see a lot of places from the car and the moving truck. And so that was kind of their thing. And when I hit 16 years old, we came back to Minnesota. I was born here, but didn't live here for very long as a young child, and then got back here at 16. And then went to one school for my junior year, one school for my senior year. And then it was, you're on your own and good luck. And I did move out at 16 years old for the summer. I thought I can make it on my own. I don't want to move again. And then I was like, oh my gosh, I can't make it on my own at 16. I have to move back home. So I moved to where my parents had gone and went back to my senior year. So that was kind of why.
And when did you know that you were going to go down the nurse practitioner route?
It took me forever to know that. My young self was an artist. I still am in my soul, my girls. I was a wedding singer. I started wedding singing when I was
All
16.
right, now we're getting to the fun stuff.
Yeah, I love music, and I also love photography. So I opened a little portrait studio with a financer when I was 18. And so we opened a studio. I had my own sound system, so I would sing. And so that was kind of where I thought I would be going. And at 18, on my own, I was like, I can't even make enough money to pay my bills with this because photography, it was all, it was all film based. So we had to like get the rolls of film and the big cameras and send it into the labs and all the things and retouch it. And so I would spend nights retouching, days taking photos, weekends singing. And even still as an artist, it was hard to pay the bills. I'm like, I got to go back to school and do something. And I had always wanted to be a doctor. And I knew I wouldn't because there wasn't any money. There's no money to go to college. I'm like, how can I go back to school and make something of myself so I can do my art and have a real job? And so I applied for a grant, for a $2,000 grant for a technical college. And I thought I can at least do that. And I got the grant and I was so excited. I went to school for a year on this $2,000 grant and got my medical assisting certification from a technical college. And at the graduation, I had a woman come up to me and she said, we're looking for someone like you because we need a clinical photographer and we also need an assistant. Would you consider doing your internship with us? And I said, sure. What kind of clinic are you? I said, yes, what are you? She's like, well, we're a plastic surgery clinic. And I said, well, that sounds kind of interesting. I'll be happy to give it a go. So I went there for 3 months for my internship, and then they offered me a full-time role. And so I was just pumped because I was so happy. I was doing my clinical photography. I was doing, medicine, meeting. It just, for me, it really was great. And I thought, oh, this is like the marriage of two things I love: the art of surgery, working with patients, and also just the art of photography, because I learned photography in a different way, which is consistent clinical photography. So I thought, well, this is going to be my life and I'm going to be here. But then I got the bug to go back to school for nursing. And being broke, I'm like, okay, how can I do that and work full time? Because I need to go to school. And there was a night program I found. It was a night and weekend program. So I thought, well, I'm going to do that and I'll work full time because it was a 6 a.m. to 6 p.m. work, go nights and weekends. So I did that for 5 years and I got my RN license. And then during that time, I fell in love with the surgeons were doing collagen injections to patients. And I thought, that's so cool. You can actually like make a wrinkle go away without surgery, without like hurting the patient too much. I want to do that. So as soon as I graduated with my nursing degree, I went to my surgeon and said, hey, can I learn to do that? That collagen is so cool. And he's like, no. He said, that's my job. That's my job. And that's what plastic surgeons do. And I'm like, okay. So I called the collagen company and I said, hey, is it only a doctor that does collagen, or do you guys have any nurses in the country doing this? And they're like, well, I think we've got a couple in maybe California and maybe in the East Coast somewhere. And I'm like, well, would you be willing to come to Minnesota and train me? And they said, well, yeah, you got to take this test and you have to inject X amount of patients, 2 days worth. And I said, okay. So I scheduled the patients, I scheduled the day. I asked one of our other nurses because she was the favorite nurse in the practice and she was like 20 years older than me. And so the doctors really liked her. And I said, would you be willing to do this with me? Because then I won't get in trouble. Like I didn't tell her that because she didn't know the doctor had said no to me. So we scheduled it and all the patients. And so we had our day and our doctor was not happy. I wouldn't do that today because it was kind of illegal, I guess. But so we
Yeah.
scheduled our patients and they all came and we injected them for 2 days straight. And after that, we got our certification from the collagen company to treat. And then I went to the doctor and said, hey, I'd like to do this for patients. And so we have our certification now. And so let's talk about like getting more money per hour when we treat patients because we're making you this much money. This is how much the collagen costs. This is how much you should pay us per hour. And he said, I think he thought I was nuts. I mean, I was 20 years old. He thought I was nuts. And I'm like, I'm serious. I'm like really serious. Like you should pay us more money hourly because we're doing this for you. And it took them about 2 weeks to kind of come around to thinking, and they decided to pay us more hourly. And so anytime we injected patients, we made a little bit more hourly. And that thus started kind of my love and pursuit of I want to do more if I find more. And I left that practice a couple of years later because I had a baby and went to work with the facial plastics and onward it went. And it's just been great. It's been a real journey, that's for sure.
Fantastic. So besides the face, which is the first thing, like that's the maybe the most common area I think of when thinking about Botox and what we've been, the examples you've been showing. What are some other areas of the body that people do use Botox for?
There's a lot. So when you think about any muscle spasm that is painful, cerebral palsy children, they're all contractured up, their arms, and they'll use Botox in their arms, their legs to help relax the muscle so that they can utilize their arms and their legs. So it's amazing for that. Bladder spasm, it has changed many women and men's lives that have bladder spasm. It's when the bladder spasms you can't control. So it has been life changing in that. They use it for cervical dystonia where the neck contracts. And so they can relax that neck so patients can have more control of their kind of neck spasm. Migraine headaches, it has FDA approval for that. They'll use it in palms of hands and soles of the feet for sweating. Some people sweat so much they can't even hold on to things. So they'll use it for that. They'll use it under the armpits for sweating. They call it hyperhidrosis. Some insurance companies will actually cover that because it can be actually really detrimental to patients' mental health. So there's so many things that they can use it for. Spasm, pain from spasm, really anywhere in the body. And neurologists usually treat those departments. I'll refer to neurologists for my migraine headache patients. I'll refer them to neurology. One thing to consider if you are a migraine headache patient is you have to go through some hoops to actually get Botox and get your insurance to cover it. You have to take X amount of medications and try them. And then the neurologists, if they treat, some insurance companies are still lax on paying. They might not pay. And also when neurologists treat you, they're not really in it to make you look more cute. They're in it to get the muscles to quiet so the pain isn't there. So you might have a wonky forehead and
Mm,
things that aren't looking so good. And so usually I'll see those patients within 2 weeks, let it settle from the neurologist, and then I'll go ahead and kind of clean up what's not looking as good if they've got a brow that's doing that and one that's doing. So we'll just kind of clean it up for them. And help them feel normal. The other thing that's really interesting is there's a lot of patients that have had Bell's palsy, where half their face has paralyzed maybe from a virus or stress at some point in their life. And so sometimes we will work with neurologists or singly to kind of help the other side of the face look more similar, to kind of balance and even out a patient, because they're very self-conscious of one side of their face not moving at all and the other side gets really hyperkinetic, and so we need to quiet it to kind of match. So it is really a big help for patient confidence, especially in those situations.
For aesthetic reasons, though, like, is it used anywhere else in the body, like for other types of creases or, yeah, other things that people want to make them look more, in your words, cute?
Mhm. So patients with rosacea, which is a real
Mm.
bright pink sometimes, and pustules on the face, it can really help with rosacea. It can help with, we call them, tech necklines for patients that are always looking down at their phone. They've got deep grooves at age 30, which they really shouldn't have, but they do. We'll use it for décolleté lines. Sometimes we'll do like we call it micro, kind of putting micro droplets under the skin to kind of just help that skin untether from the muscle it's connected to. You can use it for hyperhidrosis is actually kind of a cosmetic thing too, because some patients that are males or females, if they're on camera a lot, or they tend to sweat even a little bit under their arms and they're embarrassed about their shirts, they'll sometimes use it for that cosmetically. So there's a lot of things that you can use it for. Some people want to elongate their necks. We have some patients that just have really short necks and their trapezius muscle is really bulky. So we'll place it into that muscle to like make that trap muscle relax and then elongate the neck a little bit. So there's quite a few things you can do as far as cosmetically and therapeutically to help with various things in the body.
What is your opinion about, maybe alternative methods to maybe, tackling all these different things that you mentioned, even, things that people use Botox for on the forehead or around for the crow, the crow legs, the crow feet.
Yep.
So like things like, gua sha, all the different scraping techniques. I've seen videos of, putting breast milk on, parts of your face for those
Colostrum.
yeah,
Yeah.
or your colostrum. So what is your opinion about those things? Do you think, like, can other methods, you think, also be as successful or similarly successful?
I think that the neuromodulators are kind of something that they do something that nothing else does. One of the neuromodulators to quiet that muscle. Now, if we're talking skin retexturization and making the skin look a little prettier, making the skin look a little smoother in general, is by touching the surface of the skin with things like your gua sha is excellent for getting the puffiness out from the face because that moves lymphatic fluid out of the face. When you think of the colostrum or estradiol creams, some of those things can help with collagen production. And so thickening up that skin, giving the skin a little bit more elasticity. There's lots of skincare products out there that are phenomenal for skin retexturization, skin health. So when you think about skin health, your gua sha stones, your lasers, your chemical peels, products you use every day, and also just think about the things that we could do every day for ourselves, like getting the proper amount of sleep, eating better, right? Not having so much salt and sugar because sugar causes damage to the skin. Salt causes puffiness in the skin, so does sugar. So when you think about like your diet, how you sleep, um, and exercise makes your lymphatics move better. There's just a lot of things you can do just in lifestyle alone that can help with skin and kind of help you look, and then adding some of these tools to resurface the skin and bring out those underneath cells to look more youthful, and then giving the skin back some nourishment, which might be some vitamin C creams or vitamin A creams. So there's a lot of things that I think they actually pair together. It's like wine does one thing and it pairs with a really good meal. I feel like kind of Botox and neuromodulators really pair well with many, many treatments. And there again, if you were to come and sit in my chair and say, this is the only thing that bothers me is that I look crabby and my brain tells me I am crabby, that would be, let's try Botox or Juvo or Xeomin. Let's try one of these guys first because that's going to meet the goal you have. But maybe once the muscle is quiet, you still have a great big ridge here that you go, well, now I look like I just have this railroad track here, but I'm not frowning against it. Is there anything I can do for that? And we might talk about a low level of filler, or maybe some PRF that we draw from your blood, it's fibrin, or maybe a laser. So it pairs well with all the treatments. And that's why I think that there's not just one treatment that is usually a standout treatment. I think it depends on goals. And usually there's two or three that kind of pair together, that we want to do one first, then the next, and then the next to get the ultimate result.
So everything we've been talking about is really in the aesthetic dimension. You also, I think, I can't remember now if it was in the beginning or maybe offline, but you mentioned the wellness part of things and also the regenerative part of things. So what are those two dimensions? Is regenerative to look younger, to make us live longer, or to make our skin last longer? How does
Not, I would say not a live longer. So it's not a lifespan thing, it's more of a health span. It's like, how can we get your skin to look its best
But
and
all
to
about the skin, all around the skin, what the skin looks like and what the
it
skin,
that the regenerative aesthetics is a lot about skin and, developing putting back elasticity and collagen within the skin to keep that skin a more youthful skin. That's a kind of regenerative aesthetics. When you go into regenerative as a whole, you're thinking about integrative health and functional medicine, which is like supplements. Supplements also can help your skin greatly if you're taking collagen and vitamin C. So there's some things you can also help. Think about our skin as the biggest organ in our body. And we go work out to help our heart. We go work out to make our muscles look better. We go work out so that we don't get diabetes type 2. So when you work out, also, you are helping the lymphatic flow in your body, and skin many times looks even better as an organ when you're working out, when you're taking supplements, when you're hydrating, when you're eating properly. And so in that regenerative space or wellness space, I talk a lot of my patients about how to maintain wellness, which also, one of the reasons we want to be well is to live longer. But also during that lifespan, we want to be the best person we can be, which is more of that health span space. And so there's a lot about, goals again. If I work out every day and my muscles are strong, but I look like I'm 90 here, it kind of sucks, right? Because I'm working so hard to be healthy and to be vibrant. And then people think I'm older than I am. And now I'm mad about that. So, how then can we kind of marry how you look with how you feel? And I think that's where the regenerative and the wellness come in. And so, as a nurse practitioner now, I have the opportunity to do a lot of that. I work for Lifetime Athletic. And so, in that space, I'm able to draw blood, look at labs. We have IV therapy for hydration if we need it, and nutrients. We have supplements that we can help patients with. We can find out what they're struggling with internally and see if we can optimize that health. And then, therefore, many times patients actually look better because they're happier, because they feel better. And sometimes that's enough because they're a little more confident in how they feel. So it really, again, pairs. I mean, we're a whole organ, right? Like, we live together, all these parts live in the same space. And so anything we can do to optimize health, wellness, looks, if that's what we want, is phenomenal.
is is this aesthetic professions, all people practicing all the things that you do, is it a booming industry? Because like from it seems like it is, like it's all over social media. You see the clinics pop up all over the place.
Mhm. It is a booming industry. It is something, and the word industry is, I look at the industry from the side where companies make products, right, to help us do our profession. And with us, it's a professional medical practice. And when people get away from the medicine side of it as practitioners and only do it because of the money, that's where the problem begins. Because more often than not, people think, oh, gee, I'm going to get into this space and I'm going to make a lot of money. And I will tell anybody who's starting out, it is not a big money maker. These products are expensive. You have to have a lot of education to be good at it. And your reputation has to be excellent in order to keep those patients happy. And so there's a lot of education, in, I would say, hundreds of thousands of dollars of education that I've put myself through and continue to do so to be the best I can be. And at first, the money wasn't even there. It's like, well, you know, I'm not in it for that. I'm in it because I have a passion for this, and we'll see where it goes. And I'm poor anyway, so it doesn't matter, right? I want to follow my dream and hopefully it works. And so today I'm blessed that I'm kind of as far as I am. But for patient or for injectors that first get into it, it's really hard to get patients to come and see you when you're new because they know you're new. They look online and they see your stuff and like, well, she's been doing this for 6 months. I don't want her to jack up my eyebrows or, and so it's hard to get patients in unless you give them a deal because you're trying to collect a patient. Problem is giving them a deal. Basically, it's a loss leader. You don't make a lot of money. You're trying to pay your rent. You're trying to pay for the products, and you're really not. So I tell a lot of newer nurses or nurse practitioners, doctors in this field, like, don't quit your day job. Like, if you have a hospital job or something you're doing, like, you may want to continue to pay your bills until you actually have a reputation and a practice that you can rely on because it can go up or down. And even right now, across the country, we see that fillers in particular are down because people are concerned about the economy and they're concerned about a lot of other things right now. We've got an election coming up, the stock market does this, and people are watching their P's and Q's on what do I want to invest in? Do I want to invest in my face today? Do I want to invest in my kids' education today? Do I want to invest in the stock market? So all these things contribute in their heads to, what's important to them. And you have to be one to be able to deliver something you say you can for them to want to invest with you. And so newer practitioners sometimes find it much harder and sometimes don't stay in this profession because of that.
So have you found, like, have you seen it being like something over the last few years where a lot of people have tried to, jump on the the fad of, doing it and making a lot of money, and realizing that it's, maybe it takes longer than it seems?
Yeah, I get that feedback a lot. I teach new nurses because I want them to do this well, but even one session or two sessions is never enough for teaching because you're learning constantly and consistently. And then you'll see a nurse that gets out of school, gets into a practice, she's there 6 to 9 months, she thinks she knows everything and then she goes out to start her own practice on, this much education and this much experience and she'll come back and say, "Man, it's really hard." And I'm like, I know, like, keep a day job like a real and then do this because it is really hard. It's not easy. And I do hear that from especially newer practitioners or maybe an oncology doctor that's sick of oncology and wants to start an aesthetic practice. It's not a, hey, open your doors it's not a build it and you will come space. It's a, get out there, do your best, get yourself educated, and then you try to get new patients to come and see you for some and you just want to make a difference for them because the only reason they're going to come back is that you make a difference for them.
What are some other tools that you use, or, medical devices like the you pointed behind you, that is, that you include in your classes?
Yeah, so in the medical profession of aesthetics, we kind of have a lot of different things. So in different practices, I have different practices I work in. We have certain lasers, like there's different lasers on the market. Like in one of our practices, an example, we have what's called a Cyton laser that does resurfacing. We have a BBL laser that does hair removal and also the browns and the red spots that we get in our skin. It kind of lifts those and kind of clears up some of the vessels. We have a Moxie, which is a light resurfacing for people of a little darker skin color because it's hard for darker skin color with all the melanin to do much laser heat because it makes them darker. So we have to have different tools to fit different ethnicities. In some of my practices, we have what's called a Visia, where they'll look at the skin and see the age of the skin. They'll see the pore sizes. They'll look at bacteria on the skin.
So what does that mean, the age of the skin?
So they'll do a kind of a typographical thing where once they do a look through the skin, they can see how much sun damage is there, how many wrinkles are present in that area, how much bacteria lives on the skin, if there's rosacea present, and they can actually age the skin. And you may be 10 years younger, you may be 3 years
Mhm.
younger than your actual age, or you may be older depending on sun damage and all of that. So that's what's called a Visia consultation, where they'll put you in that Visia, and then you're like, "Oh my gosh, there's all the sun damage that I had 10 years ago, and now it's showing up," because that's what it does is 10 to 20 years later. So there's different tools that you can use. There's a lot more coming to market too for body, radio frequency, microneedling, even some of the venous machines where they can do tightening, they can actually do fat reduction, like cool sculpting and Venus Bliss. So there's a lot of different things depending on a patient's goal on the body as well.
Very interesting. And it's become very popular also the last few years, is the whole red light therapy.
Mhm.
Is that
Yes.
also something you engage with?
So I personally engage with red light therapy every day. I think it is fantastic. The box behind me is a higher dose mask that's in that box. So
Okay, I have myself one of those as well.
yeah. So I do a red light therapy, usually 10 to 15 minutes every morning, right when I wake up, because it can help reset your circadian rhythm. So I don't need to use my alarm clock really, because my circadian rhythm is right on. And then also what red light therapy does is it decreases inflammation. So it's great for inflammatory things like rosacea, acne, things like that. So red light therapy is fantastic for that. It also upregulates ATP in the cells. So the energy in the cells is actually upregulated, which is fabulous for red light. So, and then I have a red light blanket that I lay under every morning for 15 minutes.
Wow.
Um,
So
and then,
you do it all at once in the
yeah,
same
so
in the
I'll,
same time?
I'll put the red light on my face and the red light blanket on the body, and then I'll turn over and do the backside. So it's a 15-minute, 15 minutes. So it's a
It's it's
30-minute
it's a
morning.
it's a creepy look if someone walks in on you, right, with one of
It
those
is,
masks.
it is. Yeah. My kids are just like, oh my God. Yeah, but they know I'm crazy. So it's fine.
But
Um,
but is it something you do every day?
I try to do it every day. There are some times where I can't get it in. Maybe
Yeah.
weekends are busy and we're out of town, but I usually pack that higher dose mask in my suitcase when I travel, because I just know the benefits to it, and the glow of the skin is different when someone uses red light consistently. Usually with patients, I'll say, just start it 2 to 3 times a week, because you're getting used to, you're upregulating the ATP. So 2 to 3 times a week is great. And even on most of the recommendations, it talks about 2 to 3 times a week for most patients. I have a red light sauna. I usually get my body into that a couple times a week, because that engages heat, and like a 42 degrees Celsius, because you can get your body to sweat, which then gets toxins out, which also helps everything. So I think sauna is super important. I think hydration, half your body weight in ounces of water per day is kind of a goal. And so hydration, tends to just flush toxins out, and it keeps everything kind of moving better. So there's just so many things. Hyperbaric oxygen is another thing that I think is coming to this space in wellness even more, when you think about, pushing oxygen into the cellular matrix, and the health and the healing from that, because all of us need health and healing in different areas. So I think that's going, we actually have that at our downtown location at Lifetime. We have hyperbaric red light beds. And we also have a cold plunge, or a frozen, you get in the frozen room for like however many seconds and then you're out. But I can't take the cold plunges. That's not, I wish I could, but I've tried. It's not my thing.
You prefer the sauna.
I do.
Yeah.
Yeah. Are you a cold plunger? Do you like the cold?
I haven't done it in a while, but I'm okay with it. I used to I played soccer in college, so they used to force us to do it,
Mhm.
after practices and after games. So I kind of just got used to it,
Mhm.
and then it just became a bit of a macho thing for me, where I felt like I could handle it better than
Yeah.
others. So I just I jumped on that bandwagon of getting used to it even more.
Yeah.
And then the last few years, also one of those things that people are rediscovering, and it's so popular and everyone's trying to do it. And I even get advertisements now for all these, like, foldable ice tubs that you can
Yeah.
travel with and put up in all these places. So I haven't done it in a while, but I might next time, maybe, people are also investing in serious ones for their backyards and things like that. So maybe in
Mhm.
the future.
Yeah.
um Maybe in the future, yeah. So look, yeah. Next time I'm in, you said, are you in Minneapolis?
Yeah. Yeah. Near
So if,
Minneapolis, not too far.
so if I'm in Minneapolis, next time I'll jump in the ice tub in your downtown location.
I love
Um,
it.
Before we finish this up, I want to throw at you a question that I actually throw at all of my guests here on the podcast.
Should I
Um,
be nervous?
no, I might catch you off guard, but it's really just, the question is like, what in your life, it doesn't have to be in your profession, it could be really in all realms, but what in your life, is something that you really used to be convinced of, and you've changed your mind on, as the years went by, really just to promote, you know all of us, we're so convinced about opinions or ways of approaching things or habits that we have, that it's the best thing for us and that's the way to do things. And then you slowly unravel those things and people evolve. So I'm circling back to the beginning of the conversation. We're always evolving. So what is something maybe that you evolved in that you didn't expect you would?
Well, I will say recently, in the last 5 years, I have 2 comments on that. One is a childhood kind of right back in the backbones of your child rearing and how you are taught to believe maybe as a kid. And then as you grow up, you go, well, that makes no sense. I need to figure this out on my own. So I grew up in a pastor's home. So you can imagine, you're taught a certain faith, a certain religion. And when you're a child, you just kind of go, okay, I that makes sense. I believe that. And then as you get older, you start to realize, there's a lot of religion out there. There's a lot of faith out there. And how can there be only like one God? Like, and God is love, not judgment. Like, that was a lot of just like, I need to really work on that as a younger adult. It was a really great evolving kind of thing for myself. Then as an adult now grown up today, actually 5 years ago, and my entire life, I have not needed a lot of sleep. In my head, I'm like, I can stay up really late and I can get up really early and I'm going to maximize my day. And I drove myself constantly and thinking sleep was lazy and thinking in my head, like, I got my kids out the door in the morning and I went to work and it's this constant kind of grind. And over the last 5 years, as I developed myself with my own health and wellness, and I started a weight loss program 4 years ago for myself, I lost 50 pounds. I've lost now 55. And all of my studies in my health and wellness nurse practitioner functional medicine space, which was a 3 year journey, and now 8 years ago I started that. What I really had to put my arms around was the topic of sleep and how important sleep is for our human nature and so many things. And I'm actually reading a book right now that's called Why We Sleep. And it's written incredibly eloquently. And all the sleep studies that I've done, I'm like, you know how important sleep is for not only our mind, but our body functions and health and weight and all those things. And so a couple years ago, I got the Aura ring. I started tracking sleep. I wanted to know like what affects sleep because I want to stay up till 2 in the morning studying all the time. And I'm thinking I don't need that much sleep. And what I realized is that that's all a fallacy. In my head, for some reason, I had positioned that I was lazy if I slept more. And, those are all things I had to really kind of pivot in the last 5 years. So I'm evolving because what I'm trying to do is create better sleep patterns for myself, which I just had not done. And almost prided myself that I didn't need sleep. And I'm like, okay, I really do. And this is really important for health and wellness and longevity, maybe. But as far as, your health span, there's a lot that happens up here that I think sleep can be harmful the lack of sleep can be harmful. So that's been my 5 year, this journey that I've really had to work on personally. And I'm still learning and evolving in that space because at 1 o'clock in the morning, I can get my best work done. And so I really have backed up in my sleep space and working on that. Even still, it's been a 5 year journey.
So would you recommend, people to take the sleep more seriously and approach it differently? Would
I
you
think
would you have slept more hours if, like,
yes,
looking back?
yes. And
Oh,
I think when you're a grinder, right? When you're a hard worker, and that's how I grew up. You work hard to get what you want because you don't have it. And so that was my main focus. And now I wish that maybe I could take back, you can never take back sleep you miss. And that's kind of what I'm learning. So going forward, I don't want to miss out on that. No, I'm not a 10-hour sleeper. I mean, my brain automatically wakes up at 7 hours, and they say 7 to 8 is really what an adult needs. And I'm like, well, my brain is waking up at 7. How can I push it to 7 hours and 15 minutes? I can, would a little more be better? So I'm trying to figure out that. But I do think it's something to take seriously. And I think hydration is something, I mean, 75% of humans are running around dehydrated. I think hydration is another thing to really consider as far as 2 points of health and wellness that we're not taught. And, even physicians who are general practitioners who are working with their patients, they don't prescribe sleep and they don't prescribe hydration. And yet those are probably two ultimately incredible important things for our human needs.
so really good answer. Insightful and unfortunately counterintuitive to the way we kind of approach things, generally speaking, as a culture. Especially as we're so we look at sleeping in an extra hour as lazy and all those things, but meanwhile we waste so many hours, minutes on other things that really are probably lazy and not as definitely not as important, right?
Mhm.
As sleep. So thank you for all of the insights. I learned a lot. I mentioned we had another episode with a PA, Kimberly, California, and it was super insightful on from me learning about Botox, because I to that one I came extremely ignorant. To this one I came a bit less ignorant. So thank you for opening my eyes, and anyone that's listening out there, eyes to the industry, the medical professionals that work with the products that the industry create, and just shining a light on the things that you've seen and done, and how you're evolving. So really thank you very, very much, and I hope that we can do this again, and I hope to visit your cold plunge in Minneapolis.
And thank you. And you know what? Botox, right? A toxin
Yeah.
can help open your eyes. We actually talk to patients about that because when you take away the ability to squeeze your eyes so much here and squeeze in through here, it actually literally can help you open your eyes a little bit. And so patients come in asking for that. So speaking of opening your eyes, you'll have to try it sometime. Have you tried Botox yet?
I have not. I have
Time
not.
for a visit to Minneapolis,
Yeah,
I
yeah.
guess.
Why? So I'll take this opportunity for a diagnosis. Are just seeing my face? Would you point at a certain spot for
Well,
Botox? And
I
I wouldn't be offended by anything.
I
So
think this
please.
is a great spot for you. Like as far as just this little scowly area. I mean, you're very handsome. You need
Thank you.
nothing. But when you think about what this does when people meet you and a first impression, sometimes
Mm,
it can just make it look a little more relaxed and a little more approachable. So when we're all scowled up here, sometimes it can give people a little negative first impression, or maybe that someone's unapproachable or having a bad day. So it's not a good day to ask questions. So do you have a daughter or a son?
a son.
Son. So when your son is a little older, he'll say, Daddy, why are you so mad? And you'll go, but I'm not mad, but you're scowling at him. So as a human, we tend to watch facial expression and we assume someone might be mad if they're scowling, even if you're
Yeah.
thinking. So that's a great place to prevent some
Okay.
aging.
I always my mom always says to me, "Why are you so serious?"
Mhm.
When,
So
yeah.
that can just kind of soften that serious space. Now for being a male and you like to identify as a male, the goal would be to make sure your brows don't get a real elevation on them. So many times when we treat males that want to keep their brows at their normal space on their brow, like you have a
Yeah.
nice kind of just curve downward, is many times we'll treat just a little bit of the frontalis to make sure that you don't get any height from elevation here. So you would be someone that we would modify to make sure you're not getting too much of an elevation.
Okay, so very good. I'll definitely consider. I don't know if you can see. I have these like scars on my forehead. Can you see like
Like when
holes?
you raise, I can see the little line right there, but as just on the screen, I can't see
Yeah,
it. And I'm not sure if the screen doesn't pick it up as much, but when you move your
yeah,
forehead up, you can see it.
yeah. So I'm wondering if that's something that
Mhm.
in the clinic they can fill. Would that be something for fillers?
You'd probably start first with a little bit of botulinum toxin, Botox or Jeuveau, something in here to just quiet the muscle so you're not moving against that scar so much. And then many times they'll do a laser treatment to help take the edges of the scar down a little bit. So you probably would go through some lighter lasers because you have a little darker skin, more melanin. And sometimes we'll use micro needling with no heat across those scars just to kind of break up the scarring a little bit. And we'll use some regenerative, either PRP, PRF, PDGF, some type of product to regenerate the tissue while we're microneedling it. So that might be something too that can be an option, especially for scarring. Microneedling seems to be really great.
Okay, so I'll definitely consider. My wife will laugh at me for having this conversation.
She'll come with you. She'll
The
come with
last,
you.
yeah, exactly. Um, so awesome. Thank you very much. I will consider, and
My pleasure.
I look forward to doing this again.
Me too. Thank you so much for having me, Jenny. I appreciate it.
Thank you, Connie. Before you hang up, just to quickly, do you have another 2 minutes?
Yeah.
So thank you. So that was awesome. By the way, I'll cut it there.
Okay.
That was awesome. Thank you very much.
Of course.
You really are. You're great at this. So thank you. And that was fun. Was it okay for you?
Yeah, it was great.
Yeah.
Thank you. You're a great host.
Thank you, thank you. So just to really just learn about you, because I did see also you have a website, right?
Mhm.
That's because I wasn't sure if it was yours or not.
Yeah.
So do you sell also online educational content?
Yeah, so I have quite a few things that are out there right now. I designed a flip chart, an
I
anatomy
know.
flip chart for teachers that are teaching other students. It really helps with anatomy. Also for those of us, maybe nurses that are injectors that maybe aren't as familiar at anatomy, where they can kind of use as a resource to teach their patients. I have a policy and procedure manual that's available for those that are getting started and are trying to get their business set up.
Yeah,
I have some fun, sweatshirts and bags that are kind of fun, talk anatomy to me, that we use for conferences and things. So yeah, there's a few things out there, some posters and such that I have a shipping room that's here, and we ship out every week something to somebody.
that's awesome. And do you have an online course? Because like your teachings, do you have anything online that you've done?
So I don't have anything that's published online that injectors can go to and see. I'm working on potentially doing kind of an online library that we would do some courses that they could come in and actually do. I have taught for a company that records all of our stuff, actually two different companies, and so they do have some of those classes on their sites and portals. But my own, I'm actually kind of thinking about like how to get that going now that I'm here and have a lot of content. So
Yeah,
that'll be
really.
hopefully someday I can do that.
Really cool. All right. So, that's our forte is
Oh,
creating courses online. So if you need any, advice, want to talk about it, want to do something together, we'd be very interested, at least to brainstorm with you.
yeah.
So we create courses on more like manual therapy, like for massage therapists, body workers, PTs. We have some yoga, some Pilates, some things like that, all for continuing education for PTs, athletic trainers, massage therapists, that type of thing.
Mm,
And yeah, we take it pretty like seriously. All of our
mhm.
stuff are like produced properly produced in the studio,
Nice.
and some good stuff. I'll send you some examples.
Yeah.
Um, so
Where's the
great.
studio at, Danny? Where's your studio?
So most of the stuff we record in North Carolina.
Mm,
We do have we have a couple of presenters in Australia and in the UK as well. So we do some stuff there. But in
okay.
the US, it's mostly in North Carolina.
Okay. Yeah, send me
Yeah,
some examples of that coursework. I'd love to see that.
yeah, I will. So thank you very, very much again. Thank you for taking my call a couple months ago for the first time.
Of course.
Um,
Thanks for
and
asking me. This was really fun. So anytime you
absolutely,
want to do another one, let me know.
absolutely. And so once I have the recording, I'll share it with you as well.
That'd be great. Thank you
Awesome.
so much.
Thank you,
Have a
Connie.
great night. Good
Bye
luck
bye.
with
You
that
too.
baby. I didn't hear the baby at all.
I know he's a good boy.
Good boy. All right. Have a good
See ya.
night.
Bye bye.
Bye.